Okay, so this is chapter 6, pelvis and thigh, of your trail guide textbook. And we're going to learn about the bones first of your pelvis and thigh. And we're going to learn about all these little bumps on those bones and all these nuances and features of these bones. Why are the bumps on bones important? Why do we learn all these silly names for bumps on bones? Somebody.
Why are there names on the bumps?
Yeah, why do I, what?
What did you say? I'm sorry.
I said, why do we waste time learning about the names of these bumps on these bones? Like, why do I start out this way? What's the point?
Is that like a groove or a location?
Well, they are. They are Go ahead. Sorry, what?
I mean, for like location purposes.
Absolutely. I like that answer. You're right. Helps me find out where I am on the body. Miss Hanson, what were you going to say?
Is that where muscles attach to them?
Yes. Yeah. By the way, Miss Peach, you're absolutely right. It helps you locate where you are in the body. But yes, all the bumps on bones tend to be muscle attachments. And I mean all of them. You don't have accidental bumps on your bones in general. If there's a crest there, a ridge there, a spine there, a protrusion, a tuberosity, whatever they want to call it, a nodule, a depression, a crevice, they all tend to be bony landmarks. Yes, they're bony landmarks, Miss Stanley, and bony landmarks help you find your way around. You're absolutely right, Miss Petrie. And bony landmarks are where muscles attach, Miss Hanson, and muscles therefore can pull on those bones, and that's how we get movement. Remember, bones are levers. Yeah? So the bone part tends to not be as exciting, but it's probably the most important part of the whole muscle discussion, because if you don't learn about the bones, you can never figure out where the muscles are really attaching, how to find them, and what they're going to make you do. So that's why we're doing this. Okay, we're going to skip by this, not because it's Naked Man, because it's not that important right now. There we go. Okay. So this is a picture of hip bones and thigh bones, right? You only have one thigh bone in each side. That's your femur. You see that long bone? That's your thigh bone. That's your femur. We actually already know a couple of muscles named with femur in them. There's a quadriceps muscle named with femur in it, rectus femoris, and there's a hamstring named with femur in it, biceps femoris. The femur is the longest, strongest, heaviest bone in your body. It is extremely powerful. It is also the bone in which you make most of your red blood cells and white blood cells inside it. It is a bone that you almost never see broken, except in car accidents, because it takes so much force to break it. It takes another car or something hitting it. You rarely see it broken in athletic injuries. It's usually instead a knee or a lower leg bone or whatever, but not the femur. I'm not saying it never happens, but I'm saying it's rare. The femur fits into the hip and creates what kind of joint? Somebody tell me what kind of joint that is, where the femur is inserted into the hip.
Is that a ball and socket?
It most definitely is a ball and socket, and it is the best example of a ball and socket in the entire body. Remember, we called our shoulder a ball and socket, our glenohumeral joint, but remember I said there wasn't much of a socket there, right? So this is a real socket. Your femur really fits into a socket in your hip. So you also rarely hear about somebody dislocating their hip. They might say they have, but to really knock that thing out of socket is just about impossible if you haven't broken it first. So that is a ball and socket. Balls and sockets are capable of lots of different movements and lots of different planes. Yeah? So this this joint is capable of allowing you to do flexions and extensions, abductions and adductions, and even arguably circumductions. It can allow you to do medial rotations and lateral rotations of the hip. Pretty much anything you can think of, the hip can do. It has a wide range of motion, not as wide as your shoulder, because your shoulder is actually composed of several joints working together. But if I asked you what your thigh bone is, the answer is your femur. Yeah? Miss Torres, what is the bone in your thigh called? Miss Torres.
Sorry, your femur. You scared me. I was writing it down.
I'm sorry I scared you. It is scary. Anyway, thank you for writing it down and taking notes, Miss Torres.
I'm all into writing it down. Then you're like, Miss Torres. I'm like, what?
I know. I'm sure that sometimes you sit through the whole class like, is he going to call me or not, kind of thing. It's got to be a little bit nerve-wracking. Hey, Miss Hanson, what's your thigh bone called?
Femur.
Femur, yeah. What are some of the muscles that can be found like around the femur?
Your hamstring.
For sure, your hamstrings.
Muscles.
I'm sorry, hamstrings and what?
I was just saying the hamstring muscles. The quads.
The quads, yes. So the hamstrings on the posterior side, the quads on the anterior side, and what muscles on the medial side?
Your abductors.
Your adductors, yes. Adductors. They add you back together. Yeah. Cool. And so how many adductors do you have?
5.
Yep. How many quads do you have?
4.
How many hamstrings do you have?
3.
Yeah. So you guys have 12 big muscles wrapped around those femur bones. Yeah? Cool. Cool. Okay. So let's talk about some of the features of the hips now. We've talked about the femur a little bit. We're going to talk about it a lot more, but we're just going to start out here. If you look at the side view of this person, down in the right-hand corner of the slide is the side view of a hip. Okay? The side view of a hip is looking at somebody from the side. And you'll see 3 bones there. The ilium, the ischium, and the pubis. When you were a little baby, those were not fully formed together. They were 3 separate bones. And it's why people still refer to them that way. They're completely fused now. The ilium, ischium, and pubis make up your hip 100%. But they fused together in childhood. I should know what age, but I don't. It might be actually still in the womb. But the point was they were 3 separate bones and they fused together at your hip joint socket, which is called your acetabulum. We'll get to that later. So those 3 bones came together and made your hip joint socket, and that's where your femur hooks into. That's your hip joint. That's your ball and socket there. It's got a lot of different names for it. We'll get to that later. Because this hole here in your hip is called your acetabulum. Some people call this your acetabular femoral joint. Some people call it your coxal joint because they call your hips your coxals. So some people call this your coxal joint. Some people call it your hip joint. Those are all very legitimate. But let's talk about the hip bones. I want you to actually touch yourself so you can really relate to the fact that you can palpate all these bones. So if you touch the top of your hip bones up here, you are touching, from front to back, by the way, the crest of your ilium. You're touching your ilium up here on the top part. This is the crest of your ilium. It's the top part of your ilium that you're seeing from the side there. If you reach back to your bottom, kind of where it folds into your leg, and get your hand pretty medial and you push up there and feel a bone, probably doesn't feel great to push on, that's your ischium. You sit on it all the time. If you're sitting on a hard chair in school, you'll feel it. And that's called your ischium. And some people call your ischium your sits bone because you sit on it. Not to be confused with your sits muscles, which is why I hate the term sits muscles. Those are your rotator cuff muscles. A lot of people call the ischium your sits bone because you sit on it. And you can even touch your pubis, by the way. It is above your reproductive organs, and it's a hard bone right here, and that's the front of your pubis. So all these bones are very, thank you, by the way, Miss Petrie. I actually really do want you to touch these on yourself so you know where they are. By the way, there's a little tail hanging off the back there. I don't think it's labeled in this side view, but that's the coccyx. That's your little tail that comes off your sacrum. You can touch that too. It is actually, to be very blunt, it's actually kind of in your butt crack, right? It's way down here, and it's way back there. You won't ever be that low on a client, so you'll never touch it on a client, but you will be touching their sacrum, which is above that. So the hip is made out of 3 bones fused together: the ilium, the ischium, and the pubis. Miss Stanley, what are the 3 bones that make up the hip?
My favorite bones to talk about, the ilium, ischium, and pubis.
Cool, cool, cool. My favorite bones to talk about too. I like that. Thank you. Miss Monreal, do I have you back? Maybe? I keep getting weird views of you. All right. We'll get you. Mr. Kandaris, what are the 3 bones that make up the hip?
The ilium, the ischium, and the pubis.
Cool. Thank you, sir. Miss Hunter, what are the 3 bones that make up the hip?
Ilium, ischium, and pubis.
Thank you. Which one is most superior?
The ilium?
You are 100% correct. Yeah.
Awesome.
Which one is inferior and anterior?
Pubis?
Yes! Excellent use of your directional terms. Which one is inferior and posterior?
I'm gonna assume that's the ischium.
Yeah. Yeah, it's low, it's low and behind. Yeah.
Okay.
That's kind of where it is in your behind, yeah? Cool?
Yeah.
Good. Miss Nguyen, what are I know I've been picking on you a lot today, I'm sorry. What are the 3 bones that make up your hip?
Ilium, ischium, and pubis.
Yep. Ilium, ischium, and pubis. By the way, guys, we're being joined by a prospective student who's looking into coming to our January start. We have a January start coming, so not into your class, obviously. But his name is Travis. Hi, Travis. Good. And so him and I were talking about what lecture's like, and I'm like, well, you better just come to lecture to kind of find out what lecture's like. So you missed the best part, Travis. We had a riveting first hour. But anyway, we're on to this next hour anyway. And Travis, if you have questions, feel free to chime in.
Okay, I'll be right back. I'm on the other line with someone, but I'll be right back.
No problem, sir. Do your thing. Cool. All right, everybody. So, ilium, ischium, and pubis. And I'm sorry, Miss Nguyen, can you say them one more time?
Ilium, ischium, and pubis.
That was all, I would say it was 99% perfect. That was fantastic. Ilium, ischium, and pubis. Thank you. Thank you, thank you. All right, Miss Monreal, it looks like you're coming in clear again. I'm going to try this one more time. What are the 3 hip bones?
Ischium, pubis, and ilium.
Which one is most superior?
Ilium?
Absolutely. It's most up, yeah. Which one is most inferior and anterior?
Ischium?
Well, that's by your bottom. Is your bottom anterior?
I was thinking posterior.
Yeah.
So, pubis.
Pubis, good. Which one is inferior and posterior?
Ischium.
Good, thank you very much. What is your thigh bone called?
Femur.
Cool. What kind of joint does it form with the ilium, ischium, and pubis? What type of...
Ball and socket.
Yes, ma'am. Ball and socket. Thank you very much. Cool, cool, cool. Okay. So, guys, the hips are made up of the ilium, ischium, and pubis. And they're connected in front. If you look at the picture up above, not on the side anymore, up above, they're connected in front at the two pubic bones. They come together on each side. We call that the pubic symphysis. And when I am pushing on myself right here, down low, right in front, that's your pubic symphysis. It's a pubic bone from over here coming together with a pubic bone over here. That is your pubic symphysis. That is where your hips hook in front. Right? Because they kind of make a bowl. Your hips are going to make a bowl. They hook, the front of the bowl hooks together at the pubic symphysis. Where do they hook together in back? How do they hook together in back?
At not the coccyx, but not exactly lumbar. What's after?
What is after the lumbar?
It's the sacrum, right?
Yes, they hook together at the sacrum.
Okay.
What do you call that joint? Between
The sacroiliac joint?
Yes, you have a sacroiliac joint on each side, and that's where they join together. The sacrum joins them together and back. By the way, the sacrum is not considered part of the hips. The sacrum is considered part of the spine. The sacrum was originally 4 or 5 bones that fused together, vertebrae, and it's the sacrum. The sacrum joins both sides of the hips together, but the sacrum is part of the spine. And that's why they say the sacroiliac joint is where all the weight of your upper body is transferred to your lower body. Because everything on your upper body is resting on your sacrum. And your sacrum attaches itself to the lower body through the sacroiliac joint. Yeah. And it can be massaged. It's tricky, but it can be massaged. It can be manipulated a little bit.
Did you say everything on the upper body?
Yes. I'm glad you caught that. It was subtle. I want to make sure that everybody kind of, well, obviously.
No, I just wanted to make sure I understood.
Yeah, everything. So that is an overview of your hips. Be right back. Okay. I ran out of my Doritos. Oh no, Miss Stanley. That's serious. Okay. We are going to find that certain muscles like to attach to certain things on your hips. And if you look at the side view of the pubis and the ischium there. Do you see how there's a hole down below the acetabulum, down below the ball and socket joint? There's a hole there. It looks like a handle down below. It is a handle down below. It is a handle for powerful muscles down below. On the back side towards the ischium is where all of your hamstrings attach. Your hamstrings actually attach underneath your bottom into the ischium. The front part where the pubis is where all of your hip adductors attach. All 5 of them attached on there. So that handle is an attachment site for 5 hip adductors and 3 hamstrings. Yes. One of your quadriceps, by the way, just one, attaches to the ilium up there in front, which is very important later, we're going to find out. But so the thing that looks like a handle is a handle. Now, in my slide, if you're looking at the notes on the side, it uses the word ramus. It talks about ramus of the ischium, ramus of the pubis, rami. we've never talked about this word before, so does anybody know what it means? Ramus? It means arm. It just means arm. Okay? And it's a way for them to talk about the ischium and the pubis. The ischium and the pubis are each like half a circle, and so they call the two things coming off the pubis the two arms, the two ramus of the pubis. And the ischium has two ramuses too. So ramus just means arms, and when we get into greater detail into the hips, it'll make more sense. But you can actually replace the word arm with ramus. Now, I don't mean arm like your brachia, right? Like your brachial region. But they mean like the two things coming off that bone. And that's what ramus means.
So,
Yeah, go ahead.
so if you needed to work on those attachment sites, you'd have to go through the gluteal muscles and blah, blah, blah. But you could, right?
Yes, I love how you always take it back to practical everyday massage, Miss Maria. So are you talking, yes, you could. By the way, the correct answer is yes. And I think you're talking about the hamstrings specifically, because those are the ones that really hook in the back of the ischium.
Yeah.
And what's really interesting is a lot of massage therapists don't go up that high. I think they think it's going to be violating, but it's not actually. If you're in the medial part of the leg, the middle part of the leg, not like the inner thigh. If you're in the medial part of the leg, you run up right underneath their glute, like in what we call the gluteal fold, which is where your butt hooks to your leg. And that's where the hamstring attaches. And absolutely, I think you should massage it all the way up that high. I mean, I really do. Because that attachment has a lot of, well, for one thing, it's the tendon attachments, and those are highly avascular. And they need extra rubbing to get blood into them. And yes, it's very important. It's very important to lengthen your stroke. A lot of massage therapists only rub half the leg. They're afraid of getting anywhere in this kind of danger zone thing, I think they're thinking. But you can safely, without violating a client, work all the way up the backside of the leg until you hit the ischium. And obviously you wouldn't hit it with force, but I try to run into the ischium when I'm working the hamstrings. And they can actually take a lot of pressure back there.
If you lay them on their side and have them pull their legs up too, it kind of pushes that part out, and like you're kind of rock them back and forth, and that's a really good way to get it.
Yeah, I've never done that, but it makes...
I don't know if you can picture that, but...
I can. I've never done that, but it makes perfect sense to me. I think it's a very creative way to get to it, yes. Yeah. So, I'm going to stop sharing for just a second to make sure you can see me clearly. All right, everybody. So, if this up here is your ilium, down here is your pubis, and this is your ischium. My pubis is like half a C and my ischium is like half a C. These are the ramus, the arms of my pubis. These are the ramus, or the arms of my ischium. Together they make that handle you see. I just want to explain that. So by the way, this is the superior ramus of my pubis. This is the inferior ramus of my pubis. This is the superior ramus of my ischium. This is the inferior ramus of my ischium. And the reason they make all this distinction is now I can talk about places around this circle, right? I can say, oh, there's a muscle over here. And instead of just being like, it's at the bottom of this circle, no, it's on the inferior ramus of the pubis. Well, now the muscle's over here. There's a muscle back over here. Yeah, that's on the inferior ramus of the ischium, the inferior arm of the ischium. So it's a way for them to talk about these half-circle bones. Ramuses are just the arms coming off these bones, so you can tell which part of the bone you're talking about. And the pubis really is kind of like this in front. And it hooks into the ramus here, and you've got the ilium up here. And so the pubis has a superior arm and an inferior arm. The ramus has a superior arm and an inferior arm. It'll make more sense, by the way, when we get into real deep detail about that stuff, but I want you to kind of understand why we might do that. It's so that we can talk about a circle of bones and know where we are in those bones. Because remember, we've got 12 muscles that attach around here. And obviously they don't all attach in one little spot, so we have to be able to talk about how they attach. Cool, cool, cool? All right. Let's go back to presenting here. Questions so far? Thoughts about your amazing hips? Okay. Okay. So here is a picture of your femur. You guys know what a shaft is. It's the middle part of a bone. Why is this shaft shown running diagonally in this picture? Why isn't it straight up and down? Anybody? Why is it tilting? They just get lazy. They couldn't fit it in the slide, so they had to...
The femur doesn't go straight up and down.
Oh.
It's like,
But my legs seem to go straight up and down, Miss Giannis, so I don't understand.
How about when keep body?
Yeah, hold on 1 second, Miss Nguyen. I think Miss Giannis was going to say something. Sorry. Go ahead, Miss Giannis.
yeah, I don't know.
Yeah, it's okay. I don't expect you to know. But my point is, when we look at somebody, right? When we look at somebody, we tend to see this. We see straight legs. And that is true. They are relatively straight. But the femur inside those legs is actually going like this. It's actually going at an angle across. The reason the legs appear straight is the way the muscles fill in the spaces. So, if my right femur is like this and I have a whole bunch of inner thigh meat, right? Your legs, when they rub together when you're walking around, it fills in this inner part, which makes the legs seem straight over here. And your quads over here fill in this part down here. And so you get what looks like a straight leg, but the femur is going diagonal. It is actually going more medial as it goes proximal. This is very important later when we massage it. And I know Miss Giannis, I know she's got a good memory, and she brought it up because her and I actually talked, I think, a couple weeks ago about scissoring the IT band. Is that what you were remembering, Miss Giannis?
Yeah.
Yeah. We talked about the fact that when you're running up the leg, if you're running proximally up the leg, that you can kind of hit the femur and actually catch the IT band in there, and it's not very comfortable. And that it's actually more comfortable to rub people's IT bands distally. It's one of the examples where I wouldn't want to rub towards the heart because it works better in this case to rub away from it. Circulation reasons I might want to rub towards the heart, but IT band reasons I might want to rub away from it. So the answer to this question is, the picture is showing a femur as it really is. It runs diagonal. It actually starts at your hips and runs down to your knees and becomes more medial. And there is a reason for this when we study structural anatomy. Once we get through this section, we'll talk about structural anatomy. But there is a reason that you don't just run in straight lines. So, okay. Let me represent here. I am hoping that some of the names on this femur are kind of obvious to you. We already know what a shaft is. Up at the top, you've got a very big round thing that fits into the acetabulum that makes the ball and socket. It looks like a ball, and it's merely called the head of the femur. We've already learned about this with the humerus in the arm, right? So this is the head of the femur. There is a weird word there you've never seen by the head of the femur called favia. Favia of the head. You will never see this or feel this as a massage therapist. It's inside the ball and socket. It's where a ligament attaches that helps to hold the femur inside the ball and socket. It's just called the favia. You'll never see one. After learning it in this class and taking a test on it, you'll probably never use it again because we never can palpate it. But the fact is, your femur isn't just sitting in this ball and socket. It's got a little ligament in there that's actually holding it in there, and it attaches to the favia of the head of the femur. Now, they show the greater trochanter. You should all be able to feel the greater trochanter on your body. It is the bump outside my hip. It is not the crest of my ilium. It is not my hip, but it down about 4 inches is a bump here, a very noticeable bump. And it's hard, and it usually doesn't feel really good to have it rubbed. And that is the greater trochanter. That is the greater trochanter. We are going to find that a big bump like that is going to have a lot of muscles that attach to it. And that's the greater trochanter. It's on the lateral side of the femur, and it's probably one of the most obvious things about the femur. One of the most noticeable attributes of the femur is the greater trochanter. It is a great landmark when you're massaging somebody, because once you find the greater trochanter, you can find just about everything else you need to find. It's also something you need to be aware of, because running over it with an elbow really hard is not pleasant. And a lot of massage therapists use forearms and elbows on the legs, which is great. But as they get up towards the greater trochanter, they accidentally run over the greater trochanter with their forearm, and it's really annoying. Really annoying. Now, if there's a greater trochanter, there must be a lesser trochanter. Otherwise, we just call it trochanter. And you can see the lesser trochanter. It's a tiny bump on the inside of the femur. Yeah? Tiny bump on the inside of the femur. We're going to find other muscles attached to that. Yeah? There's also a line between the two trochanters. And what's the word for in between? Like interstate travel. What's the line? What's the word for in between? Inter. So that's intertrochanteric line. Sounds really difficult, but all they're saying is the line between the trochanters, right? The line between the trochanters. Then we head down the shaft. And right in the middle we see the patellar surface. The patellar surface is what the patella rests on. What's a patella, everybody? What's a simple word for patella? Every gal and fella has a patella. What's a simple word for patella?
The knee?
Is it your knee?
Yeah, your kneecap, to be specific, right? Your patella bone is your kneecap, and it sits on that area right there that's called the patella surface, patellar surface. That's where your kneecap sits. Do you remember about epicondyles? Remember we had them on our humerus. This is very similar to our humerus. We had them on our humerus. They're the bumps on both sides of the humerus. Well, you've got bumps on both sides of the femur. The epicondyle on the lateral side of the femur is called the lateral epicondyle. The epicondyle on the medial side of the femur is called the medial epicondyle. And then below that you see lateral condyle and medial condyle. Those are the actual parts of the femur that interact with the bone below it, which we're later going to learn about as the tibia. Hey, there is a tubercle there called the adductor tubercle. Anybody want to guess what type of muscle might insert into the adductor tubercle? Just
One of the adductor muscles.
yes, one of the adductor muscles, right? And probably not the adductor brevis, huh? Because it's not long enough, right? More likely
yeah,
it
so
would...
it'll either have to be the magnus or the longest then, right?
Fantastic guess, yeah. Yeah. The magnus in this case, but that's the type of thinking I want. I'd much rather that than you memorize the answer to that, right? Because it shows that you're listening to the language of anatomy and that you're actually applying it now. That will stick with you forever. Cool. In this picture, this next slide here, they're just showing you the back side of the femur. They're showing you a crest between the two trochanters. By the way, you've got a greater trochanter and a lesser trochanter. They're like mountain ranges, and there's a crest between them. And that crest is the crest between the trochanters. The word for in between again is intertrochanteric crest. We will find that lots of important lateral hip rotators attached to that. Hey, Miss Petrie, you're kind of on a roll with this attachment thing. What do you think attaches? What do you think attaches to the pectineal line?
The pectineal line?
Yeah, what do you think? What muscle might attach to the pectineal line?
Oh. I can't say the word. I can never say it right.
Well, it's the pectineal line. What muscle do you think might attach to the pectineal line?
I don't know.
Oh, anybody?
Pectineus?
Pectineus. The pectineus attaches to the pectineal line. Pectineus, one of your smallest of your 5 hip adductors. The pectineus attaches to the pectineal line. Some other stuff attached to it too. But anyway.
Yes.
Yep.
That's the, pectineus is the,
It's one of the 5 hip adductors.
yeah, thank you.
Yeah. So my point there was just to show you that the names match up very well.
Sorry, I blew that one.
No, you're fine. You just wanted to give somebody else a chance. I know what you were doing. That was nice of you. Medial lip of the linea aspera and lateral lip of the linea aspera. So, I'm going to tell you a little story. It's completely stupid, but my teacher told it to me 25 years ago, and I still remember it. So, my teacher told me a story about having a garden in the backyard where they planted asparagus. And that's how he remembered that there are lines of aspera, linea aspera, on the back of the thigh. And it stuck with me forever because my parents used to have a garden in the backyard and they planted stuff like asparagus. I don't know if they actually planted asparagus. But ever since he told me the story about the linea aspera, about the asparagus being planted in his backyard, I have never once forgotten that there are lines on the back of your femur called linea aspera. There's a medial and lateral one. By the way, later we're going to find out your hamstrings hooked to those. That's why they're important. But that's the medial lip of the linea aspera and the lateral lip of the linea aspera. They're the edges to this line of asparagus on the back of your femur. Medial and lateral lip of linea aspera. That's just how I remember that they're on the back side, posterior side. Your hamstrings are on the back side, and we're later going to find out they like to attach to that too. We're going to find out actually your quads like to attach in there, really. Anyway, whole other subject. We've got a whole bunch of fancy words on the bottom here, all built off of condyle, right? You've got a medial and lateral condyle. Up above them, you have what are called the epicondyles, which are the most pointy parts of the condyle. Way above them, you have supracondylar lines. Supra means above. Lines above the condyles are supracondylar lines. Supracondyle. And again, we can see the adductor tubercle, which must hook to an adductor. You will be able to use these pictures when you're taking your test on this because we want you to just read the book and kind of start to match stuff up. But I wanted you to kind of hear about it first and to realize pretty much all of these spots are where muscles are going to attach later. Pretty much. Not all of them. One last thing I want to show you guys. I'm going to unstop sharing here so you can see me. This does not work really well with scrubs on, so you're not going to be able to actually see, but I want you to do this to yourself. Up here in front on my hips, on the anterior part, I've got 2 bumps. One on each side, right? Thank you for those of you that are touching your hips. These are called your anterior because they're in front, anterior, superior because they're up on top, iliac spine. Spine just means a bump, just means a bump. Believe it or not, your spine is just a whole bunch of bumps. But this is called the as-is, the anterior superior iliac spine. If you follow the crest of your ilium to the back, way back here, you'll find two bumps back here. You sometimes find these on each other. They're kind of where people's dimples are on their back. Those two bumps are the posterior superior iliac spine. Anterior, in front, superior up, iliac spine. Posterior, in back, superior up, iliac spine. It's kind of the front of the crest of the ilium and the back of the crest of the ilium. Super important parts on the hip. And you can trace those on a client from front to back. And massage therapists usually abbreviate those. If you do it, I'll ask you to say the whole thing just to make sure you know it. But they'll call the front the as-is or the ASIS. And they'll call the back PSIS. But it's anterior superior iliac spine, posterior superior iliac spine. And not to confuse you, but that does mean that there's an anterior inferior iliac spine and a posterior inferior iliac spine. Yes, but we're not going to get to that yet. Just worry about these two. These two are super important landmarks. Super important landmarks for finding your way around the hip. In fact, the three most important landmarks I think on the hips, one's not on the hip, it's the greater trochanter on the femur. Then the other one is the ASIS, and the other one is the PSIS. Because with those I can find three different very important spots on the hip. So I just want to kind of point that out to you. All right. So let's stop there.